B. Visual impairment, VI. VI is subdivided into two groups. First one is blindness. Blindness denotes an almost total absence of sight or complete inability to see. Persons with blindness use white cane for mobility and braille for reading, writing. They sometimes may take support of a sighted person if needed or use other aids. The second group is low vision. The persons with low vision have limited vision. They may pull objects close to them or use magnifying glass. They might be unable to read from the blackboard, but bringing it close or large font may help. The field of vision is also limited. C. Hearing impairment, HI. HI is divided into two groups. The first group is A. Deaf. Deaf represents fully deaf people with hearing loss above 70 dB. The second group is B. Hard of hearing. Hard of hearing represents partially deaf people. Hard of hearing people have partial hearing and they may use hearing aids and other devices. With amplification devices, they might be able to hear speech sounds. And with support of lip reading, they might understand speech, however, not as same as hearing people. Persons with 60 dB to 70 dB hearing loss are termed hard of hearing. The deaf and hard of hearing groups are present under hearing impairment. Most deaf people use sign language to communicate. A few deaf people also go for cochlear implant and speech therapy. Similarly, some hard of hearing people use speech and some prefer sign language. That is how both deaf and hard of hearing people communicate, but there are lifelong challenges as well. D. Speech and language disability. Speech and language disabilities may be caused by conditions such as laryngectomy. As a result, speech might not be possible or clear. It might require speech training and practice. The person is able to hear but not speak. Speech and language disabilities may also be caused due to aphasia. There might be brain injuries leading to aphasia or problems in language reception or expression. The person may be speaking fluently but not making any sense. This causes communication problems and may need training. 2. Intellectual disability. ID is characterized by limitation in intellectual functioning. Earlier it was called as mental retardation, MR, but the appropriate term now is ID. Persons with ID have lower IQ and limitations in reasoning, learning, problem solving. This also impacts their daily living activities and skills. It is further divided into two groups. A. Specific learning disabilities. It means that person is able to manage other skills but there is a specific learning problem. This may be related to numbers and calculations or reading, writing, or spelling. It may cause confusion as person may not be able to identify letters and numbers correctly. The learning disabilities can be challenging but with training the skills may improve. Letters, especially the ones which look the same such as B and D etc. can be confusing. The similar shapes become difficult to identify, hence read, write. Regular training and support can be helpful. Important to know that persons with SLD might not have low IQ or mentally retarded in any way. However, the condition poses lifelong challenges. Autism Spectrum Disorder (ASD). ASD is a neurodevelopment condition typically appears in the first 3 years of life. It affects persons' social interactions. The person might engage in repetitive behavior and may get upset by any sudden change. The person might not be comfortable with touch or hugs. She might not be able to understand other person's perspective and may not make eye contact. It is associated with rituals or repeated behaviors. But ASD is a spectrum, that is, no two people with ASD might be the same.